Good afternoon. On the occasion of the World Environment Day, on behalf of the H T Parekh Foundation and Sattva, I warmly welcome all of you to the official launch of our report, Navigating India's Urban Heat Landscape, from Challenges to Driving Action. We are looking forward to a rich and engaging discussion, and we are thrilled to have such a diverse audience joining us. I just wanted to share a few quick housekeeping rules before we start the discussion. The video and audio for all participants will be muted, and if you have questions, kindly type it on the chat. We will address these questions in a curated fashion as much as possible. Kindly also note that this meeting is being recorded. If you are facing any technical issues, please message our support team. The number will be pinned on the chat. This 1-hour webinar is structured in two parts. The first part will have a panel discussion, and in the second half, we are going to provide a brief overview of the study. And with that, it's my pleasure to invite Ms. Zia Lalkaka, CEO, the H T Parekh Foundation, to introduce the foundation's vision towards building urban climate resilience. Over to you, Zia.
Thank you, Granthika. Good afternoon. Today, 5th June is widely celebrated as World Environment Day, although I would like to think of it a little differently. For me, it is a day for the awakening of a collective conscience of being mindful of the environment and our consumption needs. It's about the small things that we create awareness about and integrate as change into our busy urban lives. In February this year, precisely 25th February, we saw the onset of the first heat wave of the year in the states of Goa and Maharashtra in a month that is generally considered a winter month. The IMD also confirmed that February 2025 was the hottest February in the past 125 years. A few weeks later in mid-March, Orissa recorded high temperatures between 41 to 43 degrees on 2 to 3 consecutive days. This was then followed by the onset of 2.5 grueling months of intense summer heat across the country, including warmer nights and severe night conditions. A premier global agency, the World Meteorological Organization, has declared 2024 as the warmest year on record so far. Its decadal data on climate change forecasts that global temperatures between 25 to 2029 are expected to continue remaining at record high levels. This warming, especially for the South Asian region and in particular the Indian subcontinent, will lead to more heat waves, heavier rainfall, rising sea levels, and warmer oceans. What I just said is not a doomsday prediction, but akin to the fear of Frankenstein coming true, a story that defines the anxieties of modern day living against the backdrop of climate change and the fear of the unknown. I'd like to now move to introducing our foundation, the H T Parekh Foundation. My name is Zia Lalkaka, and I'm the CEO of the H T Parekh Foundation. We started our work in 2014 and spent the first decade as a corporate foundation implementing the CSR mandate of our parent company, the erstwhile HDFC Limited. Since early 2024, the foundation is now operating as an independent domestic philanthropy in India. As we enter our second decade of work, we have commenced this journey in building a flagship program called Revive, an urban climate change initiative. While deliberating our strategy for Revive last year, we set some base indicators on what this flagship program should address. Amongst other things, we were clear that this initiative should, 1, address a problem of the future, 2, should be an area that we remain invested in for the long term, and thirdly, over time, we want to build a body of knowledge and learnings to build thought leadership in this area. As part of our strategy, we also spent a considerable amount of time evaluating multiple thematic areas under the umbrella of climate change. While studying data points over the past decade with respect to urbanization in India, we saw the exponential growth of new urban centers, especially across Tier 2 and Tier 3 cities. These cities, driven by an increased built environment and a reduced blue-green cover, were fast seeing the development of heat island pockets and therefore the resultant impact of heat stress on the health, livelihoods, and productivity of urban communities across all socioeconomic strata. To us, urban heat emerged as a nascent and relatively underfunded climate action area and definitely stood out as a problem of the future. Going ahead, our philanthropic investments around heat will include support for robust data, action research, grassroots and community level pilots, and fostering an innovation ecosystem for affordable cooling solutions. Drawing from the strong interlinkages of urban heat with waste management, the urban ecology, water, and wastewater, our investments over the next 12 to 24 months will support both organizations and initiatives that are cross-cutting across these themes. 2 years hence, this will enable us to build some critical learnings and then deep dive into a more focused approach towards urban heat mitigation. With this objective in mind, we approached the team at Sattva last year to undertake an urban heat landscape study for us. The report being launched today is a preliminary findings study that aims to understand the critical dimensions of India's urban heat ecosystem. It is structured around 9 key insights that move from identifying core challenges and gaps to offering practical solutions. For us, this is a base study to really understand what exists in the Indian ecosystem today and who the potential actors are, from the government to academia, from think tanks to innovators and grassroots implementing organizations. Over time, our endeavor is to create a body of key learnings, data, and research that will become public goods for all players in the ecosystem. We also want to foster an environment for focus group discussions and convenings to enable open dialogue on urban heat issues. I'd like to close by saying that the impact of heat stress on a country like India cannot be overemphasized, especially as heat will adversely impact people's health and productivity in the medium to long run. This goes beyond impacting just the poor, just the urban poor, or certain vulnerable people. It will impact cities as a whole and the manner in which they function. Hence, it is imperative that this effort needs to be a collaboration between the government, industry, academia, and philanthropy. My wish list for the next year is to enable a set of like-minded funders to come together and create an informal heat coalition, setting a common agenda to support investments towards heat action. This group of funders should be aligned to take a big bet on heat and invest risk capital in various areas, including research and data, heat action plans, and innovations that consider solutions for both the built environment as well as nature-based solutions. If this coalition is successfully formed, then over the next 4 to 5 years, philanthropic investments on heat action will encourage and embolden many other funders, especially from within India. The time to think is over. The time to act was yesterday. Before I hand over to Aarti, I'd like to thank the entire Sattva team, including the leadership, for their efforts and time spent in bringing this report to life. The effort started in November last year and has taken 6 months to conclude. I can't possibly mention every team member's name here, but thank you once again to Sattva from all of us at HTPF. I'd now like to invite Aarti Mohan, co-founder of Sattva, to give her perspective on what it meant to Sattva to build this report on a nascent topic, the approach and methodology used. And over to you, Aarti. Thank you.
Thank you, Zia, for eloquently bringing focus to this really critical issue that brings us all together on this World Environment Day. On World Environment Day, I hope it reaffirms our efforts individually and as a collective to tread lighter on this planet, underscoring all of the issues that Zia spoke about. And I'm delighted at the opportunity to work on this really important area with the vision, support, and stewardship of the H T Parekh Foundation. ably guided by Zia Kaka. So 6 months ago, we started to investigate the urban heat landscape. And here we are with our preliminary findings report. And it is preliminary given the complexity and multidimensionality of the issue. And where we are seeking to understand, perhaps for the first time, the entirety of India's urban heat ecosystem and each of the stakeholders that work in it and the kind of solutions that are emerging, and also look at what are the actionable pathways for developing heat resilient cities. Like Zia mentioned, we delved into 9 key insight areas. And using these key insight areas as a compass, we were able to further investigate what innovations and solutions are being looked at and how different actors are collaborating to bring together a holistic focus on this area. Although we know that heat is an urban issue across as much as it is a rural issue, our report tries to pull together more focus on India's tier 2 and tier 3 cities, as these cities are projected to absorb more than half of the country's growing urban population. As a methodology, and given the nascency of data in this area, we have based our research on extensive literature review, data analysis of several public data sets and reports, and interviews with over 42 experts in the ecosystem. After the panel discussion, we really hope to delve into the insights that will be presented by the Roshan from the H T Parekh Foundation. With this, I'd love to open up the report and would love for all of you to use the QR code to scan the report. And if you have any feedback, if you have any thoughts on the report, please write to us at the email address that we will soon put on chat. With that, I will pass over to Grantika to take us forward into the webinar today. Thank you.
Thank you, Aarti and Zia. To build on these insights, we now turn to our panel discussion, where we bring together a dynamic group of leaders from the fields of urban resilience, development finance, and sustainable planning. Each of our panelists bring a unique and deeply informed perspective on heat stress, adaptation, and resilience building. I'm delighted to introduce our esteemed panelist. Our first panelist is Bijal Ben, Director, Mahila Housing Trust, a champion of inclusive urban development. She brings over 2 decades of experience working at the intersection of gender, informality, and climate resilience through women-led, community-based models. Next, we have Dr. Dinesh Arora, Principal Health Specialist, Human and Social Development, the Asian Development Bank. Dr. Arora is a public health leader with over 2 decades of experience across South Asia, Middle East, and North Africa. At ADB, Dr. Arora manages projects focusing on health, climate, and pandemic preparedness, and has also driven large-scale health reforms and digital health innovations. And rounding our panel, we have Ms. Jaya Dhindaw, Executive Program Director, Sustainable Cities, and Director, WRI India Ross Center. With over 20 years of experience in urban strategy across India and the United States, Jaya spearheads initiatives in urban planning, mobility, and climate resilience, effectively bridging national policies with city-level implementation. We are honored to have this distinguished panel with us today. And now, to guide us through this crucial conversation, I'm pleased to hand over to our moderator, Krishna, CEO and co-founder, Sattva Consulting. Krishna brings in a deep expertise in development consulting and a keen understanding of climate resilience. Over to you, Krishna.
Thank you so much, Grantika, Zia, and Aarti, for getting us started. And Jaya, Bijal Ben, and Dr. Dinesh, welcome to the discussion. I'm kicking off this discussion from the city of Bangalore, sitting in a AC office that I did not need about 3 years ago, because now even Bangalore has started to touch close to 38, 40 degrees. And 2024 alone, I'm told had over 554 heat waves in India. And I think it's only getting more and more difficult to live in some of these urbanized ecosystems. And this is only not only an environmental challenge, as we see this, it intersects with health, livelihood. A lot of our conversations with city commissioners, they're taking calls of switching off traffic lights between 12 to 4, for example, in some of these heat stress areas, because they can't have traffic personnel or police kind of man these streets. And all of us are also very fond of our gig economy, where we have people delivering stuff in the middle of these ecosystems as well. So there's a big angle of livelihood and health that's coming in because of the heat stress. Plus also, the whole challenge of development, and this is not like we are stopping anytime soon. So challenges, opportunities, innovations, all of those are topics of discussion today, including policy, given the work that some of you are already doing. And I'm also so happy to have all of you, because you all represent various facets of this problem and the solution, both from implementation, innovation, and, like I said, policy. So thanks so much for being here. And Jaya, maybe if I can start off with, given your background in WRI, both at India, and I'm sure you're hearing some noise at a global level on this topic of heat stress. If you can set the context for all of us on how much heat and hence how much stress, for all of us now.
Sure. Thank you, Krishna, and also Zia and Aarti for kind of setting the context for this discussion, but also for the study that you're releasing today. Congratulations on that. So Krishna, I think I will start with, the pervasiveness of the heat problem, I think, is well known by now from all of the numbers that different folks have quoted. And in India, it's it's pretty well known. Some of the data work that we did to find out, how much heat and how much effect it's having. And just, in April last year, we noticed that, when it's kind of considered spring in Indian cities, it was still 80% and above of the population was exposed to extreme heat stress, and that's saying a lot. So that's just kind of to say that, how pervasive this problem is. But also to situate it in the policy landscape, I'll just give you a brief sort of context about the three sort of large types of plans and policies which are governing the space, right? So on the one hand, we have heat action plans in the city, which we know have been proliferating since the Ahmedabad incidents after the 2012 heat waves. There's the cooling action plans, which are taking root now, coming from the ICAP, the India Cooling Action Plan, the guidance that has been set at the national level. And then there are the climate action plans themselves. And then the question is that, what are these different plans doing, and are they cohesive enough for us to kind of bring these threads together meaningfully? So if I just talk about, these three types of plan to begin with, I would say that, once the first notable heat action plan for Ahmedabad was done post 2012, several heat action plans have been developed, state level, city level, and actions like, access to drinking water, changing work schedules for informal workers, boosting hospital capacity or healthcare capacity before, during a heat wave are some of the actions which have been put into place in some cities. Also in response to, on the disaster side and the things that are usually done on that side, although it's a separate story that heat has not been notified as a disaster by NDMA recently, and that was pretty sad. So now, while these can be seen as positive steps forward in achieving sort of a minimum baseline of life-saving actions, but many of the important long-term actions towards building resilience are still entirely missing in cities. Also foundational actions like, just expansion of weather stations for more granular data on heat variations within a city, looking at, how urban heat islands are formed, where they exist, how are they impacting people. Training heat action plan implementers are only seen in some cities, and that uptake is not a lot, right? So this reflects largely a lack of ownership of existing heat action plans and limited capacities of public agencies in general for the uptake. Coming to the cooling action plans, the focus really over there is on things like cooling demand, energy efficiency, refrigerants, the technology side of things. So it's looking at space cooling, cold chains, all important things, but mostly kind of geared towards GHG, mitigation or mitigation first focused. on how to reduce and manage cooling demand, really. So they do talk about some things like the HAPs and the need for like heat action plans, but they don't go into the whole necessity of, how do you address things about people, vulnerable communities, and so on. So while the ICAP is providing sort of the anchoring on the topic in a way to talk to states about it for the actions needed, and ECBC and codes like that also are kind of taking some of that conversation forward, but again, it's not effective. Climate action plans at the state and city levels, which have also been evolving. Heat is one of several hazards that these climate action plans address. And while the plans that WRI India has been kind of creating, Mumbai, Bangalore, have recommendations, they're at the city level. They are adaptation focused and would require ward level sort of roadmaps to become actionable. So in a way, the cooling action plans and CAPs can be seen as complementary in certain capacities. So I think in all this, we must acknowledge that these are all first generation plans. You can't expect them to be perfect and answer all the questions. But what still remains is a couple of things, this whole limited recognition of heat as a major risk and a disaster. Like I said, NDMA has not notified heat waves. There's a lack of adequate and relevant data on extreme heat impacts, especially coming from the ground, to make this data more reliable and robust. Also, the ways in which we are taking heat measurements, air and temperature-based, land surface temperature-based. There's a lack of guidelines for addressing impacts on heat stress on people, nature, biodiversity, and various infrastructure sectors. Those aren't being looked together, in a cohesive way. And in India, it's important because people and things are exposed and different and have sensitivities in varied ways, informal settlements, street vendors, people walking, office people. And then there are these existing silos among stakeholders, working across different sectors, including healthcare. And there's a need to include healthcare professionals in the formulation and implementation of a lot of these plans. So I think the important thing to note really is that none of these plans have statutory backing. And so what we need now is a way to build and integrate ground-up intelligence and create a common platform from which different stakeholders can derive the information they need to take action in a comprehensive way and through systems and not just a solutions lens. So the second generation of plans, one hopes, address heat, should take cognizance of these shortfalls and gaps to ensure that upstream we are enabling, cohesive financial flows, which is a bottleneck in many cases, and downstream we have the tools to take the right set of actions to protect people, biodiversity, and infrastructure. And then we also finally need to ensure coherence of these plans with schemes and programs, again at the national level, be it Amrut, PMAY, Nagar One, and more importantly, the urban health missions. So I'll leave it there. Thank you, Krishna.
Thanks a lot, Jaya. So clearly, what's at least encouraging is that the first generation plans, at least in some of the cities, is up there. And of course, there's going to be learnings to put it all together. But I think two very important things that I pick up is, one, there's a need to bring it all together. Otherwise, this is not as effective. So there's hence potentially an important, policy angle there. And we need to bring also, various expertise to the table, especially things around health, public health, and, and other things. I think, Dr. Dinesh, this is probably the right time to get your, kind of input on what, from a Asian Development Bank perspective. Of course, you're probably hearing about this at a regional level, and your views on how policy is evolving, in the space. And what do you think we're doing right in India? What can we do more? And any examples, while of course there are challenges, I hope you can also inspire us with some solutions.
Thanks, Krishna, and thank you, Jaya, for setting the tone, and thank you, Zia and Aarti, for for setting the context of the webinar, and congratulations on the launch of the book. Let me wear my medical hat and say that what does heat cause a human being? Well, there could be direct impacts, there could be indirect impacts. It starts from, we can afford, when we tell our children that when you're going out, please put sunscreen over yourself, right? It's because we know temperatures increase and they can hurt you. They can have rashes on the skin. There can be heat cramps. There can be heat exhaustion. Imagine a plight of a daily wage worker in the field working, and what facilities or what luxuries he or she can enjoy in the field. And that's where the equity angle comes. Now, we have not showcased heat stress as a public health crisis. It is still meant to be a municipal issue where we don't have heat officers to manage this. It is still held by a health officer as an additional charge, and it is then relegated down when any outbreak of disease happens, we immediately rush to it. Have we realized what is heat causing chronically to people? The studies have shown that people who work outside and are exposed to sun have 37% more kidney diseases.
Wow.
But where is the data to suppose that it is caused only because they were working in the field or they were working in the gig work in the construction somewhere? I can vouch that when I was at Niti Aayog, we had a state where we said that there were so many deaths likely to happen because of heat stress. And the answer was, please don't create panic. There's nothing called deaths due to heat. Today, the same state, 7 years down the line, is asking us to make heat action plans for them. So huge progress happening right from advocacy, people understanding. So there's a huge spectrum of things. And let's not say when we talk about heat stress, it's only heat. It's a humidity and heat combination, along with the rising level of carbon dioxide, methane, and air pollution, which actually make it a deadly mix. And this can cause much more than just only physical effects, but also cause like cognitive mental effects, dizziness. It causes cardiovascular drain, respiratory stress. In fact, we are conducting, one of our partners, Imperial College, is conducting studies in Tamil Nadu just to understand what is the effect of heat on pregnancy and fetal distress when it happens there. And when Zia was saying that 2024 was the warmest year, let me tell you that it's like a report card. Last 10 years have been the warmest of the preceding years. And she said that 25 to 29 is no longer going to be an exception. And that's perhaps the range in which we can think. I'm sure this is going to rise further till we come up with a very concrete plan. Nevertheless, health has to become a central theme, has to become a public awareness campaign. Why I'm saying, because still doctors, frontline workers, nurses carry that credibility to inform people that this is dangerous, this is do's and this is do not to be done. Second, the human health workforce needs to be ready to deal with it. There are ways these things can be dealt but are not dealt. There's a study which showed that the people working in emergency, actually only 32% knew about heat exhaustion. They will give some antibiotics and drugs without realizing that the first treatment of line could be just cooling the body and giving them drip for dehydration. The second effect does come on the heat and the health strained infrastructure, whether it's in the hospitals or public health facilities, or even the human health workforce which is working in the field. So one on the individual, second on the public health facilities, and that's where we say that health needs to be a cornerstone and start working more on heat. We don't want this to become an air pollution where heat. The health department says that, oh, the source lies somewhere else. So what's my role actually, except that I equip the hospitals to treat people of respiratory diseases, have drugs, medicines, and doctors. No, we can't escape heat like this because this needs to be a multisectoral. We are working across India, Sri Lanka, Bangladesh, Pakistan, Indonesia, Philippines, and they are coming up with heat action plans across them and coming up with something which we had at a Bellagio conference very recently called Heat and Health Framework. I don't know if Avdesh, you can just present that one slide. I just need to push off because I need to attend a management meeting, but this framework actually tells about how multisectorality can be achieved. With H stands for health, E for the engineering works, A for architectonics, E stands for enablers, A for architectonics, and T for technology. And how actually we could form a multisectoral wing around it. My only, maybe I can ask Avdesh to present this slide, but only thing I want to say, Krishna, we'll be happy to support any of the coalition which comes. And it's important that the momentum for policymakers as well as at the grassroots level continues to warn people about the heat stress and come up with the plans, which we are doing perhaps within the Asia Pacific region. And perhaps we will love to, work together how we can do this. But thank you.
Thank you. Thank you so much, Dr. Dinesh. Really appreciate it. And I'm aware you have to head out. Thanks for making time. And we'll definitely miss you for the rest of the panel. But we'll hope to be in touch and bring your expertise to this part of the work that we all are looking to do. Bijal Ben, I think you heard both Jaya and Dr. Dinesh talk about some of the key trends, challenges, and the intensity of view. Clearly, it's the urgency needs to be upped, in many ways. But there was also the conversation of equity. While some of us can AC our way through this, like Jaya said last time, or sunscreen our way through this. It's not everybody's. Today from an accessibility, affordability point of view, everybody's option. So, how are you seeing it from a community perspective? If you can give us the real grassroots bottom up view of this kind of heat stress, and how this is affecting vulnerable ecosystems. Who's it affecting more? And any actual case studies or stories you can tell us from your experience, that'll be very valuable.
Yeah, so Dr. Dinesh obviously talked a lot more about health, and that's one big thing which the communities are getting impacted with. But I think I would also like to bring in the productivity and livelihoods perspective. And here is where we have done a few studies, and we have understood that productivity is almost reduced by 1/3. And when we talk to different trades in the informal sector, we realize that they were doubly impacted because the customer footfall also reduced during heat hours. There was a spoilage of goods. So apart from the reduced productivity, it was reduction of customer footfall, spoilage of goods, and we found that across the 4 months, if we consider it 4 months, but it's soon going to be 6 and 8, they lost almost 40% of their income due to these various aspects. And on top of it, I think the utility expenditures were also almost doubling. So if you have access to electricity, then you are running the fan almost for the entire day and night, and you are buying cold drinks and other petty things like powders and skin rash creams and stuff, which was also increased to, and utility, the electricity bills were almost doubled. So I think there was a whammy on health, there was a whammy on increased expenditure on health, less livelihoods, and then you are spending much more on utility and well-being. So all across, we found that in a year, almost 25% of livelihood loss we found.
Wow.
And especially to talk about women and children. So women were impacted much more even within the informal sector. Of course, pregnant and lactating women were much more vulnerable, but the other women said that they had dual care burden to take care of. So there were elderly and children and others who were falling ill. And so, their burden was increased with dual care. In places, I believe we've understood that water has a very close nexus with reducing heat, access to water. And so if water is not accessible, carrying water is always a burden of the women and adolescent girls in our communities. Menstrual hygiene became the toughest during these periods because, keeping yourself more clean, more hygienic, and washing yourself again and again becomes an issue. Also increased rashes. And, mental health really suffered and for the women, and that, gave rise to, heat also gave rise to higher violence. So those were some of the aspects that we could come across while, apart from the health aspects that we were dealing with. And one of the things that we found that when heat and humidity were there, it also increased vector-borne disease quite a lot. Waterborne disease because bacterial growth was there, and now also we find a little bit, food spoilage increasing. So whether we should be looking early on into the quality of the midday meals, or some common wedding meals and stuff like that, is we have not started yet doing that, but that could be one area later on as we go along.
Got it. So, thanks so much, Bijal Ben, for that, because it seems like you've kind of really gone and studied some of these things more deeply, and it's interesting that you're bringing out, the footfall, the spoilage of goods, and the various other nuances of healthcare, that kind of are affected by the heat stress problem. I just want to kind of follow up with another question on are there good examples of solutions that you're seeing at the community level, where some of these challenges are being addressed, maybe by the civil society organizations, maybe by the local bodies. We heard a lot about planning, but actual solutions on the ground, things that are happening on the ground, that can you talk a little bit about?
So some of the things that we have been doing very early on as a part of action was start to work with cool roofs, what we call cool roofs, because that is the part of the built environment which is exposed the most and it has the maximum impact. That was very early on, I remember in around 17 or 18, and also with the support of HTPF. And then we realized that, only working with the informal sector, because if all the built environment around you, especially in cities, is going to keep throwing heat, you are going to be impacted. You may have household level solutions. And that's when, our women started demanding from the city to take some action on heat, and we started making heat action plans. And within that, also city level solutions. So, for example, some of the things which have been happening and which is that, we get cities to appoint chief heat officers and start early warning systems. Now, that again, in some sense, is that we have to ensure the coordination between the Indian Meteorological Department and the cities. We have come up with some solutions like we have done cooling stations. And these cooling stations are actually meant for the public in transit. So, not only at the household level with our own communities who we empower, but also for the normal people like who are gig workers or even sales people or even retail people doing retail banking, because they are transitioning all the time. Very recently, because we realized that cities will also be looking for very low cost solutions which can be easily done, and we still wanted to impact the very low income and the poor. So we did a cool bus stop in Ahmedabad, which is really taken up by other cities very well, because the space for the bus stop is already existing. And so now it has been demanded by Jalgaon, by Indore, by Baroda. So various other cities heard about it. It was quite a lot talked about, and they have already started demanding. On the other hand, we also have to look at cooling solutions, passive cooling largely we have done because we are with the community, working with the informal communities, and we want them to benefit the most. So we could be looking at, urban forestry and blue networks and how to really revive them. One good thing that we found, at least with the small and medium towns, not so much with the metro cities. The metro cities were already heavily built up, and what they could do was only give you some plots which they identified as gardens. The good thing with small and medium towns was that we could look at the entire city and do some land use planning on what was public land and private land and institutional land and stuff like that, and bring afforestation to the entire city. So some of these efforts are going on. And I think separately, we had some efforts also going on on vector-borne disease and water quality aspects. But we realized at the community level we could integrate it, but not at the city level. Those two don't really speak to each other. And we recently went to the city of Ahmedabad and told them we would be very excited to, if you can share some ward level data on vector-borne disease, we can focus those, because we are doing a geo AI based plan there. And they were very reluctant to share, because I think municipalities are very reluctant to share the health data because it's a bit sensitive. Even in that case, we found smaller cities were much better because they wanted technical assistance. They had no capacity and also no one approaching them to do that. So now very recently, I'm seeing CCH also is emphasizing on health plans. So for example, in the city of Patan, we are working on climate action, and now we'll be doing heat action plan. But I have also seen the health plan coming up, and of course the two are not speaking currently, but we will now have to do that as we go
Very
on.
nice. No, so encouraging to hear some of these things, Jilan, both at a community level and some of the things that you're looking at a ward level or a city level. And from the talk of the roofing solutions to the bus stops getting a little bit of a upgrade, to also looking at solutions at least at a tier 2 tier 3 city level, where better planning can be done through infrastructure and green zones and things like that. Jaya, that's where you are an expert in planning these kind of cities, tier 2 tier 3 cities, where I think we can still act and act fast in some sense. What is your sense of how that ecosystem has to now evolve from a city infrastructure urban planning perspective, and where are some of the potentially some low-hanging fruits or some wins that are possible within that ecosystem for us from a solution lens?
Yeah, from a solution lens, and I think, Krishna, we've been sort of experimenting also ourselves in sort of different cities. First, with respect to sort of green infrastructure or nature-based solutions, and then looking at, of course, the climate action plans, and then also looking at, what this means for sort of development plans in a lot of these cities, right? So I think, one is just the recognition that, heat stress and much like many other climate risks now are no longer a seasonal concern. They're chronic urban challenges, and they intersect with health, they intersect with equity, infrastructure, environment, and all of that. So I think from our sort of systems perspective, we see urban ecosystems and we see sort of these kind of development plans as critical levers in sort of building this long-term heat resilience that we're talking about and that we're mostly lacking. So I think from a green infrastructure and nature-based solutions lens, we have developed pilots in several cities, starting from Kochi and Mumbai and Jaipur, Bangalore. So we have been doing these experiments in various cities because with the whole thing that we actually don't have a lot of evidence around, how much and how far these solutions work. And that's the truth of it, right? So while we talk about nature-based solutions as being sort of the silver bullet, be-all answer to everything, and especially on heat and, shade, and to a certain extent they are, but we just don't know to what extent they are effective. What is the solution kind of, going to give us in returns, and therefore there's government signaling. But the mainstreaming in terms of these solutions in contracts, etc., has not happened. So we, along with several other partners who are working in this domain, we've also created a platform called the India Forum for Nature-Based Solutions. And the whole point of that platform is this, right? To build evidence and knowledge and awareness about the effectiveness of these solutions, to understand the boundary conditions and limitations and the externalities. So again, communities and other stakeholders can make choices and create the financing and regulatory ecosystems that accelerate the adoption of these practices, but with good sense and, making these options sort of the default and not the exception. So that is one. And I think the other point is also looking at it from a co-benefits approach. So when you're looking at some of these solutions, I think the way that we found to pitch it is not just to say that it is addressing one problem, but basically that it has a multiplier effect. It is addressing many problems. And also, most importantly, that it has, societal benefits. So socioeconomic benefits, and making the case for that has been super important, in addition to saying things like, sure, it will reduce your ambient temperature, or, it will provide shading. It has mental health and other kinds of critical benefits for vulnerable populations. But I think this whole, bringing the picture of health within this, talking about this in terms of education also, cannot be looked at in isolation anymore. And those intersections is something that we are mapping so that these actions can be coherent. And a lot of the caps that we have developed are speaking to that. I think the second part around sort of this master planning, or, how do you make these, the non-statutory part of, what is going on in cities with respect to heat action plans or climate action plans, how do you kind of give them legitimacy and salience is the other part, right? So how do you evolve these master plans to embed climate sensitivity, which so far none of them have done. They're long-term plans. So a lot of this means integrating heat risk mapping into master plans, zoning regulations, looking at materials. How do you discourage heat trapping materials, land use patterns, built form that can ensure that expansion, and especially the kind that we see in peri-urban areas, and what is happening in small towns, because there is poor planning or lack of planning in these places, doesn't compromise sort of natural buffers and green cover and green areas. So to this end, we are also evolving research around sort of carrying capacities, peri-urbanization policies, and tools like land suitability analysis, which can be used to make informed decisions. But I think to make all of this count at the end of the day, we do need institutional commitment, and which means embedding the climate and ecosystem thinking into urban development plans, pushing for the kind of institutional architecture we need that gives the agencies that are involved often the mandate and the tools to act, and then creating these shared data platforms that can guide decision making and guide the choices that different stakeholders are making at their ends.
No, and it's thanks for that, Jaya. And I think it's also quite encouraging that there are quite a bit of action happening, in the nature-based solution space in India, with so much of entrepreneurship / innovation beginning to happen with variety of ecosystems, in that space. And I think we are beginning to reach a stage as a country where we don't necessarily have to always borrow this, because this could be also the strength of our country, given that, we had some old practices that could be brought back, to action in so many different ways. And I'm also very, thrilled to hear Zia talk about the fact that, H T Parekh will focus on bringing these innovations into these ecosystems as solutions that could benefit all of us. While we're coming to the end of the discussion, I want to pick a couple of questions that's coming, from the audience. Maybe first one, Jaya, for you to respond. Aren't climate action plans and heat action plans, the same? Shouldn't they be treated together? Why are they two different plans? Isn't it better to have them, in the same conversation under the same umbrella? Looking at them as two different plans, what's the advantage or what are the challenge?
No, absolutely. And I think that's what we're saying, that it's not just climate action plans and, heat action plans, but also, the India cooling action plan, and then the cooling action plans which cities are kind of doing. And then on the other side are disaster management plans also, which kind of look at the rescue and recovery part of things. So yes, the whole point is that we do need to drive coherence amongst all of these plans. And I think, when you look at a decision maker sitting in a city, for them, oftentimes the question they get asked is, oh, but we have this and we have this other plan, and, what do you want me to focus on? And also in the cases of cities, there's limited resources. And so when they're thinking about where am I going to spend my money on, it's very confusing, frankly, for the stakeholders who need to take action, be it at the community level, be it at the sort of public agency government levels. And so the whole point is, how do we drive this coherence? And that's where this platform and, the question of this platform, which can basically then start to inform action, both for public officials, private sector, the people who are going to be funding and financing a lot of these actions, as well as at the community level, the innovators who are bringing in solutions. All of this becomes really important. So then the question is that, what is the medium to get these plans to integrate? And so one is, can you build a common platform, basically that whoever comes to this platform, whichever type of stakeholder I am, and I have certain limitations, I have certain ambitions and aims, can I derive a set of actions? Can this plan give me a set of actions that I can actually go in and do something about in a legitimate way? And, again, from, platform is one thing, but then the important thing underlying all of this is also data. Can we build the kind of data platform also, so that, on the one hand, we have sort of the granular level data coming in and sort of feeding the kind of solutions that we need to create, but then we also have the longer term sort of action plans, which can then inform that this is the kind of data that we're seeing from satellite imagery or urban heat island and all of that. And what do we do from the more ground up level? So I think both data and all of these plans and the information need to come to a platform. We have AI, we have so many tools now, which can then help us, also think through how do we get to solutions.
So it's modularization and bringing all of this modular stuff, but also integrating through the right pieces. So it's an and not an or. We need both and the integration of this. Bijal, is it possible to create heat action plans or action plans at a community level? Not necessarily always at a at the city level or at the ward level, or the government level. Can it be done by civil society? Can we create plans for let's say informal workers, street vendors, pregnant women? Is that possible? And how does civil society participate there? A quick response from you.
Yeah, it's already, I think ward level plans are already being made. So we have done ward fact sheets for Bangalore, ward level planning. And as the day goes by, even the land satellites are really giving, closure grids so that you get more accurate data. But what we also do is we do community level heat mapping. We have started designing vendors markets which are climate resilient. So essentially in the context of India, largely flood and heat resilient. So I think settlements and markets and they could be, the work has already pretty much, it's in the early stages, but it has started. So in that sense, it's very encouraging.
Wonderful. Since you've been absolutely amazing panelists, I now grant a wish to both of you, saying if you had a magic wand, what would you wish for, for this sector of, or the problem of heat stress? What is that one, wish that in the next 2-3 years as an ecosystem we should focus on? And if you can just prioritize one. You can go, Jaya, first.
Go. All right. So I would say that, while we've made important strides in recognizing heat as a critical sort of an urban public health issue, it's still within a small section of society where we're having these conversations. So my wish would be basically greater awareness and bringing sort of the data and evidence to bear on what needs to happen, and then giving that away as tools for people to then act on.
Wonderful. So a wish to create more greater awareness and hopefully better integration, through all of that stuff. Bijal Ben, your wish.
Yeah, so I see a huge policy gap, maybe speaking to Jaya also. So I think integration of cooling, heat and health plans at the policy level. And I think communities and especially women to lead the creation of those plans so that they can also own it along with, the other stakeholders in the city and get the benefit out of it.
Wonderful. Fantastic. I think both very, very, very good, wishes, and, hopefully Zia and her coalition will help, will grant those wishes for all of us, as they move forward. But thank you so much, Bijal Man and Jaya and Dr. Dinesh, of course, who left us a little earlier, but really appreciate all your inputs. I know we could have gone on for much longer, lots of questions pouring in as well, and we'll try and answer as many of those later on, with the audiences. But thank you so much, and look forward to, collaborating and strengthening this ecosystem and creating more urgency in solving for this very, very important problems, that we are facing. But thank you so much. Back to you, Grantika.
Thanks, Krishna.
Thank you, Krishna.
Thank you, Bijal Ben and Jaya, for a truly insightful and engaging discussion.
Thank you.
Now, to take us deeper into the heart of the report, I now have the pleasure of inviting Roshan Rathod, Lead Research and Knowledge Management at the H T Parekh Foundation, to walk us through the key findings. This will provide an overview of the critical challenges identified, the current landscape of solutions, and the emerging white spaces that require urgent and collaborative attention. Over to you, Roshan.
Thank you, Grantika, and good afternoon, everyone, for being here. Thank you. Thanks, Aarti, also for laying the foundation of what the preliminary, study was really focusing on, what was the urgency, etc. I think through the panel as well, we have sort of established Why heat? Why now? Why is this such an escalating crisis? Unpacking the crisis. So I don't want to dwell very much into the data points because we've been establishing that to the panel, but just to try and focus a little bit on this number, right? We've been seeing the number 554 in many of the reports, in all of the coverage we've been seeing on heat for the past year. It's a starking number. It's 554 heat wave days that were recorded in the year 2024, are also recognized as the hottest year on the planet as yet. But what is more alarming is that last year, in the year 2023, this number was at 230. So there has been a 2x increase in the number of heat wave days across India. Right, many of these days were recorded. If you see, I'm sorry that the map you won't be able to see very clearly, but it's available on IMD's website. It's an interactive map that showcases the number of cumulative heat days across each district in India, which has shown a 2x rise as well. Along with this, what is more concerning is that I want to get into a very specific point about urban heat, right? We heard from Jaya, from Dr. Dinesh as well, about humidity being a key component of rising temperatures, as well as to how we feel heat, right? There is a temperature. Even if you would see on your apps, right, when you look at your mobile apps and you see what is the temperature looking like today, it would say 30 degrees, but feeling like 36 degrees. That feeling like is what are the additional elements that contribute to this increasing crisis on heat. So coming back to another point was the nighttime temperatures, right? So every time we've looked at heat thresholds, the way, government agencies are also classifying heat is always based on daytime temperatures. What is very crucial to understand that nighttime temperatures play a very important role in cooling the bodies and helping our bodies recover from the heat that we're exposed throughout the day, right? Our buildings, our roads, and the dense construction around us in our cities itself trap all of this heat, a phenomena that we call the urban heat island effect, right? This accumulated heat really takes a toll on our health, on our livelihoods, especially on vulnerable groups like the elderly, the children, low-income families, etc., right? What really contributes to nighttime temperatures increasing? There was a study that was conducted a couple of years ago where 141 Indian cities were investigated upon, and it was found that there are nighttime warming trends that have been observed over the last couple of years, right? Now, these nighttime warming trends, majority of the reason, so more than 60% of this warming trends was attributed to urbanization. Urbanization in the form of roads, of our buildings increases, the dense built environment increasing, etc. This is what attributed to it. I'll just wait for the slide to be showcased again. If you look at the list of can I have the slide back, Aditi, please? Thank you. So if you look at the list also, right, of the cities that you'll be able to see, most of these cities are tier 2 and tier 3 cities. And if you look at the city of Jamshedpur, 100% of its nighttime temperature warming was attributed to the cause of urbanization. Urbanization is a reality. It is a lived reality, and it is something that is going to continue to happen. And that is why there is an urgent need for us to look at how can we proactively solve for building heat resilience into urban planning in tier 2 and tier 3 cities. Because these growing cities, and like Aarti also mentioned in her opening remarks, right, that more than 50% of the population, of the growing urban population, is going to be absorbed by these tier 2 and tier 3 cities, it actually presents an opportunity for us to sort of build in urban resilience in urban planning for them. And based on the responses that even Bijal Ben gave today, there is an increase in willingness by urban local bodies in these cities itself, right? And there is also there is a growing interest to even learn from I wouldn't say, for the lack of a better word, mistakes, but the learnings of our larger metros. We see the way things have progressed in whether it's Mumbai, it's Gurgaon. We've seen the scale of growth, but we've also had our learnings from it. Can we really apply these learnings to our smaller growing cities and build resilience into their plans itself, right? Yeah, next slide, please. Now I would like to, just take a couple of minutes to delve into the human face of heat. Like all our panelists also mentioned and Zia also highlighted, when one talks about heat, you look at its impacts, you look at its intersections with many, many components. And three components are something that we looked at very deeply into our study, because that's how our life gets shaped as well. So how does heat really interact with health, with livelihoods, and with environment? Again, looking at some of the data numbers, the data points as well. Again, just to show a little bit of an analysis, that one looked at health, we saw that the suspected heat stroke cases, right, something that the government of India itself at a localized level maps, we saw a 10x increase from 4,000 recorded heat stroke cases in 2023 to in 2022 to 44,000 of heat stroke cases that we saw in 2024, right? That's a 10x increase. It was also found in a particular study that more than, I think there were 6,000 healthcare facilities surveyed, and these are all secondary studies that we have referred to, where only 6% of these healthcare facilities were even equipped to deal with cases that came, which were related to heat, which were related to heat. So our health infrastructure itself needed, I mean, it showcased that there is an urgent need to strengthen the health infrastructure around us, develop systems, which can, something that Jaya also mentioned, develop data platforms where we can truly understand the impact of heat on health. What are the, how is it really shaping the experiences of pregnant ladies? How is it shaping the experiences of groups with already existing comorbidities? Because the impact is further intensified for them. And can we actually build in systems and leverage the ecosystem to build systems, to build capacities of emergency preparedness and responses that we have for the issue of heat. I'd also take a minute to talk about how heat is impacting livelihoods. Bijal Ben actually dwelled quite nicely into it. But India as an economy that we see, right? We do realize that yes, agriculture is a very big part of our economy, as the majority holder of it, where 75% of our workforce is actually working in heat exposed conditions, right? It's a combination of both. This is a pan-India number, combination of both for urban and rural. But the impact that this is going to have on our GDP. So if you look at the larger picture, at a macro level, 4.5% of our GDP is estimated to be impacted by heat-related issues by 2030. That's a very, very big number when one talks about the GDP, right? A 4.5% impact. What can we really do to address it? As you can see, like, I mean, there are examples. If you've read about MHT's work, there are some insurance you can do, like micro insurances for street vendors. There is already the PM Swanidhi scheme, which can be leveraged for particularly safeguarding street vendors who are also already working in outdoor conditions. Similarly, it's not only true for outdoor workers, but the way heat is experienced by indoor workers, especially women, is also severe because of poor ventilation, poor lighting, etc. It becomes very difficult to work in these kind of conditions. So having having policies at the ULB level which can accommodate for flexible schedules, also for instead of a 9 to 5, and having respite during the day in high heat conditions could be a welcome move. Similarly, when even Jaya spoke about how heat impacts the environment, there was a study where we saw that there was almost 275 million people who would, whether they're living in the forested areas or in the buffer zones, especially in the states of Maharashtra, Chhattisgarh, Jharkhand, who will get impacted by heat, especially because heat will have a compounding effect on the rise of forest fires as well, right? So it's not always a linear connection that you see, but there is always intersectionalities that one needs to understand when one talks about a complex issue like heat, and therefore investing in blue and green infrastructure, investing in nature-based solutions, like Jaya pointed out, in understanding what the efficacy and the efficiency of these solutions are in the long run becomes very crucial. I'm sorry, I know I've run over time, but I would really like to take a minute to go to the next slide, please. a silent crisis emerging. We know it is escalating, but we're also recognizing that there are steps and moves and initiatives that different actors and stakeholders in the ecosystem are taking, although siloed at the moment, to solve for the problem of heat, whether it is at the policy, funding, or a solutions, whether it stands at a policy, funding, or a solutions landscape, right? So if you look at the policy level, this was almost 12 years ago in 2013 when Ahmedabad came up with the first heat action plan. And over the years, we've seen that many cities and states across the country have adopted at least developing heat action plans. Have we made it really robust? Have we made it very ground up? Probably not. But this is where we can build it out from, learn examples from the Thane Heat Action Plan, from Surat, from Jodhpur. How have they included vulnerable assessments as a part of it? How are they looking at tailored solutions? How are they leveraging data, etc.? And even declaring heat as a state disaster in the states of Tamil Nadu and Kerala enables leveraging funding also by the state at a, for solving for heat. Similarly, in the funding landscape as well, we've seen a very good increase in the not only the allocation but also the utilization of the SDRF funds, which is the state disaster relief funds. It's gone from 36% to 62%, which again showcases an opportunity that if heat were declared a state disaster, there is an umpteen opportunity to unlock funds that come in from the state disaster relief fund to accommodate for heat resilience measures. Within the funding landscape, we are seeing philanthropy capital. We are seeing some, pilots being undertaken maybe by CSRs as well. But we see that especially for the infrastructure required to implement, heat action plans. So whether it is actually the formulation of heat action plan, building capacities, supporting innovations, etc. It is important. The philanthropy space is really, really coming in and supporting for this. Lastly, I would like to sort of encompass all of this with also what Krishna really said, that right now these are all different pieces of the puzzle, right? And what we're trying to do is that we're trying to ask for a multi-stakeholder, like Zia also spoke about her wish list and her dream, that can we look at these stakeholders to come together? Can we ask for multi-stakeholder partnerships? Can we create these platforms for different actors for coordinated and meaningful action rather than isolated isolated efforts? Because this is actually going to enable us to not only invest in innovations, so invest in translating theory to practice, but also scale these innovations, which are crucially required in the landscape that we live in right now. I'll take a pause with this, and thank you so much for giving me the time to share the insights from the report. Back to you, Grantika.
Sorry, I was speaking on mute. Thank you so much, Roshan, for that comprehensive and insightful presentation. To formally close today's session, I now invite Aarti. Over to you, Aarti.
Thank you, Grantika. It's been such a pleasure. We had over 150 people join us and lots of very interesting questions. I'm sorry we were not able to address all of them, but we will definitely get back both with the insights of this discussion and answers to some questions that were posted during the webinar when we get back. Thank you all so much. Very happy World Environment Day to you. And thank you all for giving an hour of your time today to converge on this really critical topic and listening to what we have, discovered through our report. This is really a first step. We will be continuing to engage as H T Parekh Foundation and Sattva on this very important topic. So please do expect to hear from us as we go back. And thanks so much for joining us this afternoon. We have placed the link to the report again on the chat. We look forward to receiving your feedback and any engagement on it. Thank you.